Evening, everybody. Calling this Village Board of Trustees Committee of the Whole meeting to order on February 9th, 2026 at 6 p.m. Clerk Lauken, can I have a roll call, please?
Trustee Alfano.
Here.
Trustee Cordova.
Here.
Trustee Constados.
Here.
Trustee Kozar.
Here.
Trustee Kumar.
Here.
Trustee Sabri.
Here.
Village President Kevin Patrick.
Here. Thank you. If we could all rise for the Pledge of Allegiance. I pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Please be seated. Okay, so tonight we have discussion on the GEMT and ambulance billing, the PW Parks to go over status for projects, and CED engineering project map. Manager Rivas.
Thank you, Mr. President. I'm going to turn it over to, I'm going to believe it's Deputy Chief, or it's going to be Chief Steve Stapleton and Deputy Chief Frank Riposh.
Thank you. So as promised at the budget meeting that we had about when the ambulance rate increase comes before the board, we were going to give you maybe a COW on ambulance billing 101 and what the GEMT actually is. So I'm going to hand that over to Deputy Chief Riposh for the presentation. He's my Deputy Chief of Administration. And we also have Director Samantha Rovick from PBS, Paramedic Billing Services, here in case there's any questions. Ambulance billing is a very complicated subject, and I hope you guys study because there will be a surprise written test at the end. Just saying. Hand it over to my Deputy Chief. Thank you.
Thank you, Chief Stapleton. Tonight, I'm going to try and explain Ambulance Billing 101. I'm going to give you a very high-level overview. Paramedic Billing Services does our paramedic billing for us, and it actually can get quite complicated and quite in the weeds. So we're going to give you just a very broad view of what we're doing here. So just a little bit of history on ambulance rates. They've always been set by ordinance and typically at a static number. For years, there was no cost analysis involved. It was simply a guess. What did our neighbors charge and what should we charge? So if our neighbors Lombard were charging $600 per ambulance call, Addison was charging $800 and Oak Brook Terrace was charging $400, $550 sounds good, right? We're not too high, not too low. And that was pretty much the science behind picking ambulance rates in the past. Then we move to how we currently do our rates. With the inception of the GEMT program, we'll talk about how that comes about here in just a minute. We started in 2002 with a set ordinance. It allowed for a variable rate based on our GEMT cost report rate and set the rates at 50% for residents and 75% for non-residents. The automatic annual increase was based off the change in the cost report. And we never did decrease, we will not decrease our rates should there be a change in the GEMT rate. We would maintain the GEMT rate going forward. So what is GEMT? It's the Ground Emergency Medical Transport Program. It's a federally funded program for Medicaid. It been in existence for many years, and it is currently in over 36 states have programs like this. It's designed after programs for nursing homes and also for hospitals. We just started taking advantage of it just recently. It was introduced into Illinois in 2019 by legislation with the fire chiefs, and Villa Park joined in 2001. It's administered by the Illinois Department of Health and Family Services, or HFS, and it provides additional reimbursement above the Medicare standard base rate. So how do we get to this GEMT rate? Well, we fill out an annual cost report. The cost report comes off the previous fiscal year that has been completed. So for this year, for 2026, we are actually using an audited report from 2024 to complete our cost bases. We use everything from salaries and benefits to supplies, fuel, repair cost of vehicles, labor for those repair costs, any of our contractual services and amortized values of both our buildings and our vehicles. We also use a ratio of transports versus non-transports. We are currently using one of the ratios that was introduced back when the program started, and we are going to be moving to a newer way of doing this, a very more simple way of comparing transport or medical costs to non-medical costs. So that should simplify the process. Director Micah has been instrumental in helping us identify additional costs and also in changing our accounting practices so we can are easier for us to capture these costs and identify them for the fire department. So the GEMT rate, we fill out that cost report. It goes off to the state of Illinois, and then from there, they will determine our final rate. The GEMT program requires us to charge providers the full final rate, specifically in Medicaid cases. The state expects 50% of that final rate as an administrative fee paid back to them. And if the repayment is less than that 50%, the provider or the village in this case can be held liable for the difference. And then if you're not paying it back at that full rate, you can be excluded from the program. Providers cannot charge different rates based on residency. Here's a example of the Medicaid payment. So you'll see there that if our GEMT rate is $3,555, the base rate for Medicaid, so if we were not participating in this program, would be about $555, and these are fake numbers for you guys. The GEMT amount, the amount that we get through the federal program reimbursed is $3,000, bringing us whole for the $3,555. Of that $3,555, we have to pay back the state 50% of that GEMT amount, so that's $1,500. So in this case, the village would receive $2,055 as a payment. One of the other ways that we receive funds for ambulance transports is commercial insurance. We have no rate negotiation ability with commercial insurance. Amount paid varies by provider. It does not include, we still go after, we still try to collect from our residents co-pays, co-insurance, and deductibles. Those all still apply depending on the insurance plan itself. And then starting in 2027, the Illinois legislation passed a bill requiring marketplace insurance providers or plans to pay 85% of our ordinance rate. That is currently in 2026. So they would be charged 85% of whatever we go forward with today. Other payers that we have in the mix are Medicare. This amount changes annually. The rate is based on the region and of the country that we are in and the county. And the rate here is set pretty nominally at $450 to about $800 per transport, depending on level of service. And then we also have private pay. These are individuals who do not have insurance. So if we look at our rate structure going into 2026, if we stay on our current system of using 50% or 75% for resident or non-resident, our rates would be set for resident at $1,777.50, and for a non-resident would be $2,666.25, as opposed to the proposal tonight that would bring the GEMT rate to our full rate would be the $3,550 per transport. How does this rate compare to our neighbors? Well, it puts us kind of right there in the middle. Some of these differences in rates that you'll see between other departments and us, there's varying factors that come into play here. Call volume is a huge one. If you have more calls to spread the cost across, the rate is actually going to be lower than someone like us that has a medium amount of calls and has an amount of costs for the fire department spread over fewer calls. If you get down to Wooddale and Itasca, they have even fewer call volume. They're also districts, so they may be incurring different costs than we are, so that can account for why their costs are a little bit higher, or their GEMT rates are a little bit higher. So this payer mix that we have, that we talked about, the Medicare, the commercial, Medicaid, and also private pay, about 62%, almost 63% of our calls in 2025 were Medicaid patients. About 20 or 21% were commercial pay, and about only 13 or so percent were Medicare. And we have a very small percentage of private pay here in the community. If we were to move forward, you can see projected revenue here. Now, I need to give you a caution here. These numbers are based off the number of transports in 2025. There is no way we can predict realistically what we're going to do in 2026 as far as transports. But we use history data to come up with these numbers. And in 2025, you can see the number of calls that we ran for Medicaid, for commercial, Medicare, and private. The rate structure of the $3,555 at 50% for resident and 75% for non-resident would give us a grand revenue of about $2.25 million. And for the proposed rate of 100%, you'll see it gives us a grand total of about $2.5 million. Now, the thing I need to point out there is you'll see under Medicaid, there is no change in the revenue increase. We are currently billing Medicaid at the 50 and 75%. Luckily for us, they are reimbursing us at the 100% rate. So we're not going to get caught in owing them more money than we are receiving. However, with this, they are charging us at that higher rate because we are billing at a lower rate can also trigger an audit and also possibly disqualify us from the program. So that's why we're proposing to move that up to 100% of the GEMT rate. And any questions? I kind of ran through that pretty quick, but yes.
You said you predicted the number of, just based on last year. Has that been pretty stable, the number of calls we got for the years? Like,
From our research, that's been pretty stable, right?
Yeah.
Sam?
I would say so. The only time we really saw a dip was like during COVID when people weren't
Yeah.
doing the transports of course. But you guys are getting a busier area, you know, more car accidents are definitely happening everywhere. So if
Okay.
anything, the calls, I would think probably go up.
okay, so, but they were pretty stable overall over the years, except for COVID, okay.
So the payer mix has been constant for several years. It's
Several
been-
years, okay.
That
Pretty
could
good.
change though with demographics moving in. You guys don't seem to have a huge elderly population. Don't know if that will change within the next 5 years. Most people on Medicare is 65 and older, although we are seeing people with mental illnesses and such qualifying for Medicare.
Okay, and the Medicare private mix is what's gonna change change our revenue, it looks like, because,
The commercial insurance.
Yeah.
So your commercial insurance rate will be billed higher. So based on what commercial pays, you'll get more revenue that way.
okay. And,
Medicare has a fixed rate like Medicaid. Theirs is typically between, like you said, $400 to $800, depending on the level of service, whether it's a traditional Medicare plan or Medicare FCO. And currently, right now, they, what we call soft bill residents. So they balance bill for the difference, where like you said, deductible, a copay, but if residents do not pay, Philip writes it off. So they would not go to collections or anything like that. So as far as a resident issue, it shouldn't really affect them in the long run.
and the private insurance, do we write a lot of that off, or is that usually collected?
As far, we call it like self-pay. So
Yeah.
there's people that don't have insurance. So as long as they don't get potentially Medicaid after their hospital stay, sometimes we'll see that. So we do another run 3 months after to see if they applied for other insurances. As far as you guys writing off a lot for residents with no insurance, it's not very high.
Trustee Cordova?
So seeing that it's gonna go up, double. You mentioned, that there's some payments that are gonna happen if, they don't pay, they don't go into, collections. How does that impact the out-of-pocket? Does that mean their out-of-pocket's gonna be a lot higher? I don't know what the average cost is. I know I took one once, it was so expensive, it was super
Yeah.
expensive, and they had like an extra nurse on, it was a whole thing, so.
Go to the microphone.
Sorry.
With how 911 usually works, they don't pay for their auxiliary fees, so for them to charge that is kind of ridiculous. They just did holding for deductible, so what that means is all commercial policies, we hold until their deductible is met. So it runs through our clearinghouse called Waystar, so once they hit their deductible, we then release those calls. You won't see money so much in the beginning of the year, but we've already just ran for January and we released a good amount of calls going through. So it shouldn't affect them at all. The issue is, say they have a very high deductible, like $10,000 or something, well, between hospital bill, ambulance, within 3 months, we're releasing those. If it gets applied to their deductible, they get a bill for their deductible, but if they don't pay it, it just gets written off.
With Waystar, how long do you guys typically hold it? If you guys are already through
We
January?
run it every week.
Okay.
So we run it
to see
every
if their
week,
deductible
yeah.
hits. Cool, all right.
Towards the end of the year, it's not as necessary, but we really like to do it for January. Everyone has different deductibles and different plans. We're really lucky that we live in Illinois and have Blue Cross Blue Shield insurance. They're pretty good about paying out opposed to some other ones.
So there will be an increase to the resident, but hopefully insurance will catch that, and then once they're,
That's up to you guys. I mean, we have other neighboring towns where after insurance pays, or even it's just applied to their deductible, they write off the balance. So it's completely up to you. That private pay money could also be out of pocket for the resident. So you guys can decide, I don't want them to pay the full amount, or I only want them to pay $250. You could do that if you don't want to see it. We're pretty flexible. You guys tell us how you want and what's going to work best for your community.
But I think to your point, we are trying to put the burden on the insurance company, not on the resident themselves.
Yeah. And like he said, he's in the middle ground. He's not the lowest, he's not the highest. Our biggest concern is him getting kicked out of the program. It looks like at this point that they're charging Medicaid patients more because the rate is higher that they qualified for the cost report than you guys are billing other commercial insurance, Medicare. So like he said, that could provoke an audit and you wouldn't want to lose that amount of revenue.
No.
Trustee Cordova, you'll none?
I'm all good, thank you, I appreciate it, thank you.
Trustee Kumar?
I understand consistent billing. I would want to consistently bill all the paying parties. What we do, I think we have to think carefully about what we do with the deductibles and after cost for residents versus, I don't think we should touch non-resident. I think we should leave it as is, but if it's a resident, I think, they are paying taxes to the city of Villa Park so that we could write off some of it as part of our situation. So that's something I would,
We could do a report for you that shows how much of that private pay money is coming from your residents after insurance pays, if you'd like to see that. And again, you can change your billing guidelines with us at any time. I don't think in the ordinance it states that you guys do residents or non-residents in collections. I think it's just the fee structure, correct?
We don't send residents to collection.
No, but I'm saying it doesn't specify whether you do or not.
No, I don't think it's.
But I got the write-off summary here, so we write off around $308,000. $170,000 goes to collections, so if it is collected upon, it goes back into the payer mix. But two specific areas. Resident, no insurance, we wrote off around $78,000. And the resident waiver, we wrote off $30,000. What the resident waiver is if they have commercial insurance situations and the bill is in excess of what their insurance pays, we will bill them out 3 times in 90 days. If we do not get anything back, it is written off. So in essence, it's not punishing the residents.
And the chief has at any time to give us a call, email to write anybody off for any reason. They are allowed to submit hardships and stuff, non-residents,
for that as well.
It happens very few. Last year, we've only had 2, and they were both with DuPage County programs, so I wanted to ask for some type of documentation from the county that they are in a program or they couldn't apply for Medicaid. And then we have a procedure in place in the ordinance, bring it to the village manager, address it to the finance director, and then write it off. It's not the fire chief just, willy-nilly writing it off. No, there's a procedure, and all the documentation is kept in case there's ever questions in the future. And again, it only happened twice last year. So.
Any other questions? Okay, Manager Rivas.
Well, thank you all.
And you guys all passed? No test? I think the teacher in the room would like that one, right? Thank you.
Thank you. Next, actually, 3B and 3C is going to be commingled, and village staff is just going to speak on it. So whoever wants to have at it first, please. You have the floor.
All right. Good evening, everybody. As Manager Rivas noted, these next 2 items will be somewhat mingled together. Rather than sit here and give you all a list of updates on our various projects, we've actually been working on something. I wanted to show you what we're putting together. I should qualify that this is very much a work in progress. We understand, based on resident feedback, based on board feedback, that there's a need for more information, more updates. We recognize that the current tools that we have out there for that, either there's, in some cases, some issues with the existing tools that we've used, or we have other instances of not enough information being out there. So we are putting our heads together and trying to come up with a way of getting more information out, keeping it all in one place, and basically making things more transparent and accessible for you, for our residents, businesses, everybody. So with that in mind, I ask, again, as this is a work in progress, any feedback that you might be able to provide, any thoughts as we put this together. The content is not very well populated yet, but just in terms of the actual, the resource here, we want to show this, let you see what we've been working on and get your thoughts. So we have a projects dashboard. I should clarify, this is both public and private projects. So we recognize that there's a desire for, say, a village resident in this 300 block of South Villa. They may want to know what's going on down the street from them. They don't necessarily care that it's a private development project or that it's a village capital improvement project. They just want to know what's going on. So just as an example, I can zoom in on my location if that's where I live. In this case, we happen not to have anything going on there, but if I scroll a little bit further north, you can see we actually do have a number of things going on here. Clicking on, as an example, the Union Development. I apologize. Some of these things are still being put together. Again, content's not very well populated here, but for anyone who can see it, let me zoom in just a little bit here. Hopefully people can actually make that out. We just have a very brief general description on the project, a very brief update, and the vision on this is that this would continue to be populated and kept up to date with all of the current information and what have you. Just some quick navigation. Again, this is public and private projects. We're trying to find a way to put all of that information in one location, which is a bit of a challenge. Public projects and private projects both have very different information associated with them, very different processes for going from planning to actual groundbreaking. So we've put them in a format here that includes both. We hope that this will serve the purpose that we're trying to get across here. So we can filter on those criteria. We can also filter by the status, whether something's approved, something that's actually already finished and constructed and open to the public, proposed and under review, or under construction. So just as an example, private under construction, we have 2 projects here. That are currently in active construction. One is the apartments at 27 West Park Boulevard. The other is Albright Middle School, still running off of their referendum from, I believe it was 2 years ago. We can also filter by village department. So if you want to see just community development or you want to see just public works projects, you have the ability to drill down to that level of detail in this dashboard. I think that's the general overview of the dashboard itself. I would say it's fairly straightforward and easy to use once you get in here. This is already publicly available. It's just a question of whether we make some major overhauls to this, or conversely, if we believe we're on the right track, then we would simply continue to build this out, keep the projects populated, and make this more of a public-facing resource. That's it. I guess if there's any questions on the dashboard or on specific projects, we can certainly take those.
Trustee Costados?
Thank you. I'm glad to see this because it was actually a topic we talked about at Coffee with the Board on Saturday, was coming up with something where all of the projects are in one spot for the residents to be able to look at. Will this also include like streets
Yes.
as well? And will it include like, not that it's really a project, but tree removal as well? Because I know that's something that a lot of people ask about, is the tree removal list.
To get into the weeds for tree removal, that would be very difficult, like, to be mapping it at this caliber. We do have other tools that we do take service requests, and we keep spreadsheets internally. So for the status of that, yes, we realize that obviously there's a number of backlog for the tree removals and trimming. We've gone to area trimming per year, so unless something's deemed dangerous, then we'll actually put that ahead of the list. Obviously, that's the top priority. If obviously low-hanging branches for vehicles or pedestrians, that's obviously looked at on an earlier basis. But the amount of trees that we have, we couldn't populate something like that for this tool.
Okay, thank you. Thank you.
Trustee Kumar?
Two things. One, you said there's things that have been finished. How long is that going to stay in there? Because this map can get all full at one point otherwise.
Very much so. Our thought, and disagree with us on this if you do, please, but 12 months is a reasonable time frame in which to keep completed projects up here, just so if somebody's looking for information for some reason, they can go find it. No reason to keep something up there for the next 10 years if it's already complete and finished out.
Okay, so that's one thing. Another, the tree removal, you said you're planning to do tree removal by section, so maybe just that could be on this map when you're doing a section or a whole bunch of places, that could be on this map, but not every individual person asking for tree removal. Right.
Right, as you mentioned, the further that, like with the yearly projects, if we did that, then it would like overpopulate a particular area, so you wouldn't be able to see like some of the street projects or the individual houses or those. I mean, so that would be a little.
So there's no way to just put like a square around the area you're working on?
If we did that, you would be shadowing the other projects. I mean, even though that there's
No,
different layers, but, I mean, we could outline like an area, like, and I think in another document to show like what areas.
Sorry to help you jump in if you don't mind, Rich. We do have the tree trimming map and the years that are projected and boundaries as a separate document and a separate map.
Okay.
Listed under the tree forestry. I think there's, we're working on this and we're working on it with existing tools that we have. So there is some limitations into this program. And so it's hard to try to get every feature because it's custom built by our village engineer, Kevin Mantle. So to try to outline that a little bit, it's a little bit hard, but we do have the map, and then we do update that tree trimming zone map on an annual basis showing the years that it was completed, if they have been. Obviously, it's a 5-year cycle, I believe. And so we've completed about 2.5 of those zones. We still have 2.5 to go. So we have, like, the northern half of the community has been area trimmed over the last 2.5 years, and we're working our way south. We are looking at trying to get it a little bit reduced backlog with some contractual trimming here. but I think it would be a little bit too much and a little too crowded. We understand that when we start adding all these projects, it's starting to get very crowded and still be able to be usable. We're trying to keep it to project-based on that.
Two things with that I just want to say is you probably want to just write that, the trees are not here, somewhere on this dashboard, so that they know it's somewhere else. And also with the details, when you talk about details, maybe some dates with bullet points so that people know when it happened in the detail section for projects like, this is when this happened, this is when, so they know the progression, with just bullet points rather than, real write out, because that's not really necessary. Those are things that make it easier to read.
Understood, thank you.
All good?
Oh, good.
Trustee Constatus?
Thank you. With the trees, would it be possible not to include the ones that we're trimming, but the ones that we're just removing? Like the ones that me and you talked about where we go around and put the big X on because we're removing the entire tree?
I would say it would still get very busy. Over the
Okay.
last 5 years, we've averaged over 100 to 150 trees removal a year, so that would be almost 150 points onto this map.
Is that
plus
tree
50 other-
list accessible to the residents on our website?
It's something we could work on moving forward, is with
Okay.
the spreadsheets that we have, that we could look at the ones that are projected to be removed and add that listing to our
Maybe we
website.
could try to do something like that so people could just kind of see where they're at on the list, as far as that goes. Another question is this live yet?
Yeah,
And
this is
where does
publicly
one
available.
find it?
We can send out a link with the manager's permission, give everybody an opportunity to test it out, provide us with any additional feedback that isn't immediately apparent just from seeing it on the screen. But yes, this is live and available to the public as we speak.
And you find it where? Because I believe, trustee.
It's not, we'll have to send a link out to this. It's not linked from the village website as of yet. We want to
Okay.
have this presentation before we actually start
Start it
advertising
live.
its presence.
Thank you.
Real quick.
Manager Reeves.
If I could just add, you can send Mr. Mantles a direct email or me, and we'll make sure that we update whatever your suggestions are.
Thank you.
Trustee Sabri?
I believe one of the question was at the coffee with the board, that some of the residents, they brought up some of the trees on their front of their house was placed, and it's been a little while that it's still there, so I believe, I understand you saying because of the backlog issue. Perhaps we can make a list of it in a case if the resident calls. I think that will be more helpful, that the X is there. What will be the timeline for that particular?
Yeah, I don't have an answer to that one yet. Typically, that X is performed by our foreman. I think it went to trustee Casanos.
Correct.
As an indication to let the resident know they're on the list to be removed. I don't know what occurred on that one, if it accidentally fell through the cracks. I know there's a power line, so every once in a while that comes into play. I did not have a chance to get with our foreman yet. I don't know if Director Salerno has yet, but in that case scenario, when the X is usually on, that's usually an indication that it's set for removal, and it's usually pending in the next, I would say, 4 to 6 weeks, depending on our schedule as we move throughout the community. I don't know exactly what happened on that one, so we were looking into that and should have an answer hopefully tomorrow, unless, Rich, you have an answer.
No, we could get that answer shortly.
We understand that, we have 100, 150 tree removal or new planting, so we cannot put that on a website, but perhaps a list, if the resident call, if there is concern, yes, we are in a process or whatever is going on. And
We can work with our forestry department, but I think having the list of the trees that we have selected for the year to be, or that we have a listing of for removals, that could probably be just a simple Excel spreadsheet.
Exactly.
That's shown on the website. That might be helpful. But we do have a essential backlog. As Rich mentioned, we do kind of have a policy, an internal policy that we follow in terms of the triggers on all those. Obviously, some jump the list if they are deemed dangerous. As Director Salerno indicated, and dangerous usually means it's covering a stop sign where that now creates a traffic hazard. If it's too low and can cause damage. If there's a split, like it's struck by lightning and now it's structurally unstable, those do kind of sometimes jump the list. And obviously, I should have this number in my head, but I still, I'm uneven on how many trees we have in the community. I know it's around
It's
like.
in excess of 10,000 trees that the village has and its parkways. So obviously we're working on a situation of trimming, and obviously with staff's abilities, it's the same forestry crew that does the trimming, removals, stump grinding, as well as then during other times of the year, snow and ice removal. So that's primarily their function. So obviously they got a tall order and the list is.
So I just say that is, we generate the list typically when we start activating, but it's still kind of a work in progress because we do have other ones that may jump the list because of, we had a storm, now our trees cracked in half. We're shifting priorities to trees that are split in half versus the list of trees that we were scheduled to be removed.
Understood, yeah. Thank
It's a balancing act between then obviously the trims and then the removal, so that's trying to keep things moving.
Thank you.
Has anybody from our forestry department taken up the incentive yet to become a certified arborist?
In one of our employees' last review that I had with him, he did show an incentive to look to become an arborist. So, and also is looking to go to also the Illinois Public Service Institute classes as well. So he's looking to, obviously, yes, better his career, so to look into being an arborist, yes, we do have somebody.
Could you keep us updated on the status of?
Sure, absolutely.
Thank you. Trustee Kumar.
About that list, it would be nice to get an Excel spreadsheet that you work, and even those new things that you do, the extra ones, just dump them in there and also say what's been completed, because that's, I'm sure you have a list like that that's running. It just helps to see that you are busy, this is difficult, and so that, you know, that also reduces complaints sometimes, because people do understand that this is, it can be overwhelming. At this point, they only see their tree, and that's part of it, you know?
And then, just to build on that, we do keep a running list. Secondly, it's where we use our stump grinding. So just residents be aware for full transparency. We take trees down, I'd say 365 days a year, pending all the other activity. However, we've kind of mobilized our stump grinding to be an isolated, go through the community at a set time. So there may be a period of time where that stump is left in the ground, because it's usually fall time frame, if I remember right, Rich?
It is the fall, because that way then for restoration, we grind the stumps, as well as then after we grind the stumps, we put a mulch mix, and then obviously with seed as well, so for restoration.
So we can update that spreadsheet to say maybe removed and then stump
And
removed.
removed and waiting for stump grinding or whatever. If it's updated, at least they know you're working, you understand, and it's there, rather than fielding a bunch of calls constantly, you know, on these matters. It just clarifies to the resident.
It goes pretty well. It's how we efficiently use staff, since we have limited staff on that. But I just want to make that clear, because I know when I first got here, there was a lot of concerns about stump removals, but the guys do a great job. They usually knock it out in a couple weeks, but we do kind of do that at set periods of time. But we can maybe add that to the list, because that's typically our list is, once we remove them, they go on a list so that we keep track, so that we can remove those stumps in the following cycle, so that there usually, hopefully, is not stumps out there that are out there for years. It's maybe up to 9 months, I'd say, at most, usually.
Right, we've gotten that down from the past. Absolutely.
Any other questions? Okay. Next.
Thank you.
Thank you.
Yeah, thank you. Wait, is that it from everybody?
That is
okay.
both
All right.
B and C, yes.
Okay.
Unless there's any specific questions on projects themselves. But this was the meat of our presentation.
Does the board have any further questions, any questions about current projects or anything of that nature? Trustee Cordova?
Just a link for that, for this right here.
We'll get the link to this out to everybody.
Trustee Costados?
Sorry, I have one question I might as well ask that was on the list from Coffee with the Board, was I believe they wanted to know where the waste water was going to be going from the Union project? What was the question?
Sure. During the review process, obviously between engineering staff and Public Works, we reviewed the plans, and there was multiple connections for the existing buildings on Southville Avenue. So Eventually, all the waste does go to Salt Creek Sanitary District, and that does provide processing for the entire village. So they get all of our waste. So the end result is Salt Creek Sanitary District, but the short term is that obviously all of our streets do have, most of them all sanitary sewers. So there's actually a sanitary sewer on the west side of Southville Avenue, and they've got multiple connections for that development, so.
Okay, thank you.
Anything else?
No, thank you.
I think we're all good.
Okay.
Thank you.
All right, we will go ahead and move along to public comments. Is there any public comments for Committee of the Whole this evening? All right, seeing none, moving forward, go ahead and,
Just here to applaud this operation because a lot of people in the village wanted to know about where to find tree things, and our new site website's been updated, undated, and they're having a hard time finding it. So I appreciate the fact that as a board, you've managed to give us an update on it and where we can start finding these things. So it's greatly appreciated that you are taking into consideration that the website is getting done so we can make it a lot easier, because it is very complicated for some of our residents to find what they need. So I appreciate that you're diving into this and getting it a lot easier for us. Thank you.
Manager Rivas.
And Ms. Tucker, just a quick comment. We're also doing a lot of manipulation of background, so sometimes you see the websites might be dragging a little bit. We're doing a lot to kind of change the face and change the content and information.
Is there any other public comments? Okay, seeing none, I'd like to entertain a motion to adjourn.
I'll make,
Trustee Sabri, do I have a second?
I'll second.
Trustee Constados, is there any discussion? Seeing none, all in favor, say aye.
Aye.
Any opposed? Okay, we are adjourned at 6:41 PM. Thank you.